Greetings, everyone. This is Justin Vaughn with Miramed Global Services bringing you another article for the hospital industry. This article is entitled, "The Financial Impact of COVID on Hospitals." As we inch ever closer to the end of May, it might be a good time to look back and take stock of the way in which the coronavirus pandemic has affected our nation's citadels of caregiving. America's hospitals have always represented impregnable bastions of well-placed hope and high-tech healing, but they have been mightily battered in recent months by the massive effects of a microscopic pathogen. We know damage has been done, but to what extent? According to a national study undertaken by healthcare consulting firm Kaufman Hall in May 2020, April was a devastating month for hospitals across the country from a financial perspective. Despite the expectations of some that hospitals would be overflowing with patients due to the spread of COVID, in actuality, a sharp decline in overall patient volume was noted. This, along with a prolonged suspension of so-called elective surgeries, have translated to record-setting declines in hospital revenue. The following seeks to illustrate the scope of the fiscal damage and to assess where hospitals may go from here. This section is entitled "A Precipitous Plunge." The study found that hospitals' operating EBITDA margin, or OEM, fell by 174% when compared to the same period last year. Nationally, hospital OEM decreased 118% from March 2020 through April, as facilities faced the first full month of the virus's impact. Operating margins fell 282% from April 2019. Such margins decreased by 120% last month as compared with the previous month. Median hospital operating margins fell to negative 29% as measured by the Kaufman Hall Hospital Operating Margin Index. According to the report that summarized the study's findings, quote, "April's devastating results follow a challenging March when hospitals first saw the pandemic cause across-the-board volume declines starting mid-month," end quote. Operating room minutes for April 2020 fell 61% compared to April 2019, while discharges fell 30% over the same 12-month period. Emergency department visits dropped 43% during the same time period, and outpatient revenues decreased by 50%. Finally, inpatient revenues saw a decrease of 25% when comparing April 2020 numbers to those in April 2019. The report indicated that the plunge in profit margins occurred despite aggressive cost-cutting measures undertaken by hospitals. This is to be expected since the loss of the major bulk of high-acuity cases, coupled with the continuing maintenance of necessary overhead expenses, will inevitably combine and inure to the overall financial detriment of these institutions. This next section is entitled, "Where do we go from here?" The report attempted to address the future when it noted that, quote, "Even as hospitals look to resume non-urgent procedures, there is widespread uncertainty as to when patients will return, with the virus's path still unpredictable and nearly 40% of consumers uncomfortable seeking care at a hospital," end quote. That reluctance on the part of patients may be true, and a recent survey conducted by Miramed in mid-May indicated there are differing expectations among healthcare providers when it comes to a return to pre-COVID case levels. While not a scientific poll, we asked certain OR providers when they expected to see normal elective surgery case volumes. Over 100 respondents provided the following predictions. 1 to 15 days, 23.48%. Return to pre-COVID case levels within 16 to 30 days, we saw 33.91% of respondents opting for that choice. Those believing it would take 31 or more days to return to pre-COVID case levels were at 20.87% in number, and 21.74% were unsure. Of course, no one can be 100% certain as to the future course of this virus. Will there be a sharp tapering off in the summer months? Will there be a second wave next winter? If there is a second wave, will there be another shutdown of elective surgeries? Clearly, hospital executives have their work cut out for them. Their mission is to get up and running so as to make their institutions as financially viable as possible while simultaneously planning for the next wave and the next what-ifs. According to the Kaufman Hall survey report, there will be, quote, major changes that will need to be addressed by facility and system executives. These changes are expected to revolve around the following. Number one, care models with the rise in telehealth and new needs to manage infectious diseases. Number two, cost structure as organizations seek to regain financial stability in the face of steep revenue losses and possibly permanent changes in demand. And number three, competitive dynamics as organizations of different scales and capabilities position themselves for the post-COVID world. The report concludes that the results from the April study, quote, clarify the perilous position that hospitals are in, as well as the potential magnitude of the change, end quote. While this may sound rather ominous to some, others will accept these new realities as simply a new set of challenges to be overcome. At the very least, each hospital CEO, CFO, and/or administrator will need to perform the following assessments. Number one, what has been the financial impact of the COVID effect on our hospital thus far? Number two, what is the financial projection for each of the next 2 quarters based on the COVID effect? Number three, what should be done to ramp up resources, human and otherwise, to meet these projections? Number four, do we have the financial wherewithal to deploy these resources? If not, when will we? Number five, what internal policies and processes need to change now in order to meet the demands of the next 2 quarters and beyond? And number six, are there any other strategies that should be considered to increase the short-term and long-term financial well-being of the facility/system? Grappling with these questions will enable hospitals to move forward towards some sense of stability and a renewed confidence in the future. If we can help you in this process or provide resources or insight, please reach out to us at info@miramedgs.com. We want to be your partner in progress and profitability. Thank you.